We will continue with obstetrics. We are done with the signs of pregnancy and we will now be on the prenatal care. So this one, for the prenatal care, we will be um, discussing prenatal care on what it is in the book. Okay, so we will be utilizing military and flag for this one. So we have the components of prenatal care. We have the history taking, the physical examination, the treatment of disease, the TT immunization, the iron supplementation, health education, laboratory examination, oral dental examination. And so we will, and when to refer. So we will take it one by one. First thing we have to have, this one is from the book of Salostiano. Actually, this is 2024. We have now the new FPAL, the 4-point system. So F will stand for the number of full-term infants born after 37 weeks. So dito guys, meron tayong tinatawag na pregnancy uterine full term. So ano yung tinatawag nating pregnancy uterine full term? So pag sinabi nating pregnancy uterine full term. So we call that as your PUFT. Okay? You usually see this in the chart of your patients whenever you're having duty in the clinical area. So you have here the pregnancy uterine full term. So when you say pregnancy uterine full term, these are the number of full term infants born after the 37th week of pregnancy. Okay. So before it is the letter T, but now it's letter F. It's F. Okay, it's full term infants. We have letter P, number of preterm infants before the 37 weeks. So we consider an infant preterm if it's below the 37th week of pregnancy. And we have here abortion, a number of spontaneous or induced abortion. This one, for a number of spontaneous or induced abortion. Again, abortion is a termination of pregnancy before the age of viability or before the baby will have the ability to survive outside the womb of the mother. We have here the number of living children is letter L. But in the board exam, okay, for the number of living children, like for example, the mother came to the unit or to the institution or to the hospital for check-up and 5 yung anak niya, pero ang buhay na lang is yung 4 kasi namatay yung isa. The number of living children is 4. The number of living children pertains to the alive or the living children at the moment when the mother seek for consultation. We also have here what we call as the 5-point system or the GFPAL. So the gravida is the total of pregnancies. When we say the total of pregnancies, so it be an ectopic pregnancy or maybe an H-mole. So it could be on or under the total of pregnancies, which is G. And we have here F as, again, the full-term infants, the preterm or the premature births for letter P, and number of abortions for letter A, and letter L for the number of currently living children. So as you see, the meaning of the 4-point system, the FPAL, and the 5-point system, the GFPAL is or is the same. Okay. So we have here Q, the gravida. So gravida 1, and we say gravida 1, pregnant for the first time. So pag multigravida, with 2 or more pregnancies. So again, multigravida. Letter M stands for, again, multiple pregnancies or more than 2 or more pregnancies. Pag sinabi naman nating nulligravida, when we say it's a nulligravida, a woman who is not pregnant and now has never been pregnant. So, hindi siya buntis. She's not pregnant now and she has never been pregnant, as in nullig. Okay. We have here parity. When we say the parity, number of pregnancies carried to the period of viability. When we say the period of viability, the completion of the formation of the lung surfactant. So, sorry, hindi niyo talaga makita si mama, no? Hindi kasi ako mahilig sa ring light, again, because I am I will be suffering from migraine after 1 to 2 minutes pag meron akong ring light, guys. So, ayan. So, we have here the parity. When we say parity, it is the number of pregnancy carried to the period of viability. When we say the period of viability, when we say the period of viability, it is when the fetus is um, or will have the capability to live outside the womb of the mother, and that is when the formation of the lung surfactant or the lung surfactant is complete. Like for example, you have your um, lecithin, sphingomyelin, phosphatidylglycerol, phosphatidylinositol, and phosphatidylphosphorus. So you have here what you call as your lung surfactants, and you have the formation of your lung surfactants starts from 28 week, okay, up to uh, 34 weeks of pregnancy, okay. So the formation of your lung surfactant starts from the 28th week of pregnancy up to 34th week of pregnancy. So that is when you can call the baby is able to live outside the womb of the mother. Okay. Twins, pag twins yan, it is considered as one parity because they will be born the same day, even if they will not be born at the same time. We have primipara. When we say a primipara, a woman who has once delivered a fetus or fetuses that have reached the stage of viability. So, primi, one. Para, ibig sabihin, ay narating niya yung or the baby has reached the period of viability, and multipara, a woman who has completed 2 or more pregnancies to the stage of viability. So again, we have here multipara, a woman who has completed 2 or more pregnancies to the age or the stage of viability. Next. As we have here, signs of previous pregnancy. How would you know that the woman is nabuntis na dati? So we have the pendulous and lax abdominal wall, the presence of abdominal striae that sometimes it is not reversible. You have the labia gapes wider, even if the mother is not yet opening the labia. Medyo, okay, the labia gapes wider. And then the hymen is transformed into a myrtiform carunculae. When you say the hymen is transformed into a myrtiform carunculae, it means that the hymen is now at in the edge, okay, of the vagina. Next, we have cervix admits the tip of the finger. So when you do an IE or internal examination to the patient, when you reach the cervix is partially open, that it could accommodate the tip of the finger. That is what we call as admits the tip of the finger. And you have here sites of healed laceration of the cervix. So when you do the IE, you would feel like some irregularities inside the cervix. Okay, from the external os to the internal os, you will feel some sites of healed laceration. So if it's the first time of the mother, then the uterus is firm and tense. The frenulum is still intact. Of course, the labia majora is in close opposition. The vagina is narrow with numerous rugae. When you say rugae, again, the rugae is present in your vagina because it is the one that expands the vagina during the birth of the baby and during sexual intercourse. Okay. Next is the cervix is soft, but it will not admit the tip of the finger until the very end of pregnancy because the cervix will just have the what we call as the Goodell sign. Diba? You have the Goodell sign when the cervix becomes more profuse with blood and when the cervix becomes soft for it to be dilatable, and that happens only okay during or at the very end of pregnancy. You have here the Nagel's rule, the very famous Nagel's rule. What will you do for the first 3 months? Okay. Okay. What will you do? You for the first 3 months, you will have to add 9. What plus 9 plus 7? Okay. For the first 3 months, you will have to add 9 plus 9 plus 7. Okay. Like for example, January. Like for example, January is 1. The LMP, the last menstrual period. When we say the last menstrual period, it is the first day of the last mens. Again, it is the first day of the last mens. Come again. It is the first day of the last mens. Okay, that is what we call as your Nagel's rule. Okay, So for the first 3 months, January, February, March, you have to add 9. Okay, for example, ang LMP ko is January 10, okay, 2024. So this is my LMP. This is my LMP. So what will you do? You have to add 9, tapos add 7. So this is 10, 17, 2024. So it means that my expected date of confinement, the expected date of confinement or the expected date of delivery, okay, the expected date of confinement or the expected date of delivery for the LMP of January 10, 2024 is October 17, 2024. But if you will be referring to April until December, you will be using your -3 plus 7 plus 1. So when your EDC, okay, when your LMP is April 3, so -3, okay, -3 is 1, and then 7 plus 3 is 10, and then you have 2010 plus 1, and that is 2011. So that is what we put as your LMP. Okay, so you will be utilizing your Nagel's rule. Okay, you will be utilizing your Nagel's rule. I'm sorry, my partner is still so clingy. Okay, next we have here the determining of the age of gestation. So when you are determining the age of gestation, okay, let me just erase that one. You will be using your menstrual age or gestational age, and you will have to measure it from your LNP. Okay. What will you do for the assessment of the Fundic height? Actually, these are not utilized in the board exam. These are just good to know. But then again, you must have the idea of what is it is all about, so you may arrive at the right answer when it is asked in the board exam. So you have here the assessment of the Fundic height. It is done to estimate AOG in the age of gestation, expected date of confinement, and the assessment of fetal growth rate. So you will use your McDonald's to calculate the AOG. So what will you do? You will get the Fundic height. Okay, you will get the Fundic height. So what will you do with the Fundic height? Again, you start measuring from the fundus of the uterus into the symphysis, or from the symphysis to the fundus of the uterus. Okay. And then if you will now get your Fundic height in centimeter, then what will you do? If you will be utilizing lunar months, again, lunar months is equal to 10 or 9 calendar months. Again, lunar months is equal to 9 calendar months. So when you will be utilizing your lunar months, so it will be a Fundic height, okay, in centimeter times 2 by 7. Okay, so let me just put her down to her bed. Okay, so when you will be utilizing your Fundic height, okay, when you will be utilizing your Fundic height, if it will be in AOG in weeks and you are using the calendar months, then you will have to um, get it and then times 8 by 7. The 2 by 7 and the 8 by 7 are all constant. You have also here the Bartholomew's rule, and this is the same as the discussion of the location of the fundus, that it's when it's 12 weeks, you will see that the mother's abdomen is at the level of the symphysis pubis. And then when it's 16 weeks, it's halfway between the umbilicus and the symphysis pubis. And pag yan ay 20 weeks, it's at the level of the umbilicus. And when it is 24th week, two fingers above the umbilicus. And for 30 weeks, halfway between the umbilicus and the xiphoid process. And for 34 weeks, it is just below the xiphoid process. And 36 weeks at the level of the xiphoid process. And when it's 40 weeks, okay, it will be going down up to 34th week due to lightening. So let me just give the common board exam questions in this Bartholomew's ruling. So in the board exam, they are repeatedly asking, okay, of the level or the number of weeks when the uterus is at the level of the symphysis pubis, and the answer is 12 weeks. And at the level of the umbilicus, it's 20 weeks. And then the most difficult part is at the level of the xiphoid process, and that is 36 weeks, because if the mother is suffering from cardiopulmonary disorder or problem, then it will be very hard for her to um, be pregnant, okay, or at the 36th week of pregnancy, because it will be the gravid uterus will be at the level of the xiphoid process. I'm so sorry for um, the delay. Okay, we have here next, we have here the Johnson's rule. Actually, these are good to know. When I say good to know in the board exam, usually um, ano yan, they are not asking it, but they will be asking it. They will not be asking how to do it, but they will be asking it how to do it, or they will just be asking the meaning objectively. So sorry for that. We have here the Fundic height in centimeter. Okay, n times k equals the fetal weight. So what will you do? You have the constant of k of 155. The n is 12 if engaged. I'm sorry for the extra letter d here, and then N11 if not yet engaged. So you have to know again the Fundic height minus um, N if it's engaged, it's 12, it's 11 if not yet engaged, and times K, the 155, and you will have the estimated fetal weight. When it comes to fetal weight, actually, um, if the baby is uh, mas mabigat siya, the baby will have more chances or more chances of living, provided that the mother is not suffering from gestational diabetes mellitus. We also have here the Hayes' rule. Okay, the Hayes' rule is how to determine the length of the fetus. For this one, you will be utilizing the lunar months. Okay, hahatiin mo siya. You will have to deal with it as a half. So letter A, during the first half of pregnancy, square the number of months. Like for example, if it's the third month, okay, third lunar month, and then you have to square 3. 3 squared equals 9, I suppose. Okay, so the baby is approximately expected to be 9 centimeter this time. Another one you have here, letter B, during the second half of pregnancy, multiply the number of months by 5. Like for example, if the woman is 6 months, so 6 times 5 equals 30. Tama ba yun? Okay, 6 times 5 equals 30. So ibig sabihin, the baby could be 30 centimeter at this point in time. So when there is a greater pubic height, again, you might suspect multiple pregnancy. Okay. Another one, miscalculated due date. She may not know her LMP. She's not familiar of her last menstrual period. And of course, there could be the presence of polyhydramnios. And polyhydramnios, again, is when the amniotic fluid is more than 1,000 ml. And that could be, again, in the board exam, due to tracheoesophageal fistula. Next is, ayan, hindi ako masudang magsusulat para makinig ka talaga kayo sa akin. You have here the possibility that there is high nativity hormone, okay, or gestational trophoblastic disease, and that could be the reason why the Fundic height is larger than the normal. And if there is a lesser Fundic height, it may indicate fetal growth retardation. And when there is a fetal growth retardation, there could be the possibility of fetal-maternal complication, and that should be checked by the obstetrician. Or possibility of fetal death, or wala na talaga yung bata, or there is a problem in estimating the age of gestation, or oligohydramnios. When we say oligohydramnios, it is a scanty amniotic fluid less than 500 ml. And this could be due to renal agenesis, okay? Renal agenesis or renal problem. Again, it is renal agenesis or renal problem. Next, we have here the Leopold's maneuver. In the board exam, they will just be asking you what are the other terms for each maneuver. So, the first maneuver could be the fundal grip. It is used to determine the fetal part lying in the fundus. So if it's round or smooth, it's the fetal head. Okay? If it's round or smooth, so it is the fetal head that is down there. So it is more of the cephalic presentation. So if you feel something that is soft and angular in the fundus, and that would mean um, the buttocks, okay? I'm sorry. For the round and smooth, for example, balikan natin, okay? For, if you are trying to feel the fundus and you found a round, smooth part, and that is a head, okay? So most probably the presentation is rich. And if you found a soft, angular portion in the fundus, and that would mean that that's the buttocks of the baby and the presentation is cephalic. So let me correct myself. If you found something that is round or smooth in the fundus, that is the head of the baby, meaning the baby is in bridge presentation. And if you found something that is soft and angular or the buttocks of the baby in the fundus, that would mean that the baby is encephalic present. Another one is you have here the second maneuver. The second maneuver is the umbilical grip. What will you do here is you have to identify the location of the fetal back, because in the fetal back you could really hear the fetal heart tones, and the fetal back feels smooth and hard. So um, third maneuver, it's the pollex grip. When you say the pollex grip, you have to determine the engagement of the presenting part. So if it's movable, it means it's not yet engaged, and if it's movable, um, okay, if it's movable, it's not yet engaged, and if it's not movable, it is engaged. So we have here the fourth maneuver. That is what we call the pelvic grip. You have to know the degree of flexion. You have to know the degree of flexion. And then if descended deeply, only a small portion of the fetal head could be palpated. So hindi mo siya napapalpate. Okay. Next is you have your Leopold's maneuver. Okay, this is the picture. The first, the second, the third, and the fourth. So in the board exam, they will be asking you kung kailan nag-change ng position yung nurse. Okay? Mag-change ng position yung nurse kung asan siya mag-change ng position. Okay, you have to identify, okay, kung saan siya mag-change ng position. Okay? Next is you have here your laboratory test. Okay, number one, you have to have your urinalysis, for you to identify the possible presence of UTI. And UTI is related to preterm labor, although the direct congruency of those two things is not yet discovered. Still, they say that UTI could be a predisposing factor to preterm labor. And the common blood test that you will be having is your CBC, the RH determination, the VDRL, the HBsAg, and the rubella antibody titer. In case of rubella, okay, before you get pregnant, you have to have your titer, because you cannot have the vaccination during pregnancy because rubella is a live virus. It might cause congenital abnormalities to the baby if you are injected during pregnancy. Next, another test, it's an ultrasound. So we have here, ultrasound is to detect developmental abnormalities, the size of the baby, to confirm the position at birth, to locate the placenta, to detect the number of babies, to assess how the baby is doing. Actually, ultrasound is a common test during pregnancy for us to know the overall status of the baby. Okay. Another one, you have here, so this is an ultrasound. Again, in the board exam, what will you do? Okay, during ultrasound, is it an empty bladder or a full bladder? It should be a full bladder. Okay, it should be a full bladder for the OB-gynecologist or the sonologist to have a better visualization, of the baby and the parts of the baby. Another one, okay, so again, it should be, this one is amniocentesis. Okay. This one is amniocentesis. This one is for the detection of chromosomal abnormalities, infections, and to determine if the baby's lungs are developed. So then they will get amniotic fluid as a sample. And in amniocentesis, the amniotic fluid is tested for the presence of the lung surfactant. Okay, for the presence of the lung surfactants. And this is guided by the ultrasound. This time in amniocentesis, in ultrasound, it should be a full bladder. In amniocentesis, it should be an empty bladder, and the mother is not allowed to ambulate after the test because it could lead to preterm labor. Next, you have here the chorionic villi sampling. Actually, the chorionic villi sampling is done in other countries for them to know the possibility of a Down syndrome and genetic disorders such as cystic fibrosis. And some countries, kasi, if they will note that there's a presence of this congenital abnormalities or chromosomal abnormalities to the baby, they might decide to abort pregnancy. Next is maternal serum alpha fetoprotein. So say maternal serum alpha fetoprotein, whether it is high or low, there is an abnormality. Because if it's high, you might want to consider that there's the possibility of a spina bifida and an encephaly, and if it's low, okay, it could mean the presence of trisomy 21 or mental retardation. Okay, it could be the presence of trisomy 21 or mental retardation. If it's high, it could be spina bifida and an encephaly. If it's low, Okay, it could be the presence of trisomy 21 and varying degrees of mental retardation. Again, in other countries, they might decide not to continue pregnancy. So we have here the non-stress test. Actually, the non-stress test is done to assess FHT versus the fetal activity with the use of the cardiotocography machine. What is it again? We have your cardiotocography machine. So when you say the cardiotocography machine from the word itself, it will note the cardio, the FHT of the baby, toco, the contraction of the mother. So we have here the cardiotocography machine or the fetal monitor. So we call it your fetal monitor. Actually, your non-stress test and your oxytocin challenge test are forms of external fetal monitoring. So by the use of the cardiotocography machine, I will be showing you a picture of the cardiotocography machine later. Okay. So when it is reactive, okay, when it is normal, the result of when the baby move, pag nag-move ang baby, okay, the heartbeat of the baby will accelerate by 15 beats for 15 seconds. That will happen twice in a 20-minute period. That would mean that the result of the non-stress test is reactive. Okay. And if I may repeat, again, if the baby moves, okay, if the baby moves, the heartbeat of the fetus is accelerated by 15 beats for 15 seconds. That will happen twice in 20 minutes. And for every test, it is done for 20 minutes. And the result of the test will be just true for 3 days. After 3 days, you have to repeat again the test to note if the result is really reactive or non-reactive. So if it's non-reactive, how would you know a non-reactive non-stress test? If the baby moves, okay, if the baby moves, there is no increase in the um, heartbeat of the baby. So that is a non-reactive result of a non-stress test, and that could be the reason of the doctor to order your contraction stress test and oxytocin challenge test. Actually, your contraction stress test and oxytocin challenge test is you are generating contractions. Okay, you should be generating contractions for you to um, test it against the FHT of the baby. So for a contraction stress test, let me reiterate this in the board exam. For the contraction stress test, they use it for mothers who are not yet term. Kasi they will just be stimulating contractions by nipple stimulation, okay? They will just be stimulating contractions by nipple stimulation, okay? They will just be um, stimulating contractions by the use of nipple stimulation. And then after the contraction stress test, they could just stop it so that the mother will not have preterm labor. And for the oxytocin challenge test, actually they could give 1,000 ml of B5LRS or 5% dextrose. Okay. In a lactated drinker solution. Okay. So that they will now be incorporating 10 units of oxytocin in it. And then when the oxytocin is incorporated in the D5LRS, okay, then it will stimulate contractions and you could actually test okay, the FHT versus the contraction. So oxytocin challenge test is used for term mothers because even if contractions will now be occurring, and it's okay because the mother is full term. But for contraction stress test, it is used for preterm mothers for us to avoid preterm labor. They could just stop the stimulating the nipple. Okay, they could just stop stimulating the nipple after the test. If the result is positive, there is persistent late deceleration. When we say persistent late deceleration, guys, okay, when we say persistent late deceleration, guys, okay, when we say persistent late deceleration, let me just draw, okay? The FHT decreases at the start of the contraction and even at the end of the same contraction, the FHT is decreased when we say late deceleration. Okay, when we say late deceleration, the FHT is decreased. The FHT is decreased at the start of the contraction and even at the end of the same contraction, hindi na siya bumalik sa normal. It did not go back to normal. So when we say it late deceleration, and late deceleration is because of what we call as uteroplacental insufficiency. Okay, uteroplacental insufficiency. So we call it your uteroplacental insufficiency. So when we say positive, there is persistent late deceleration. and it may be because of uteroplacental insufficiency, meaning the late deceleration in a contraction. At the start of the contraction, the FHT decreases, and even at the end of the same contraction, okay, the FHT is still decreased. And again, this is a medical emergency. The baby should be born immediately at this point in time. We also have here negative, when the result of the contraction stress test or oxytocin challenge test is negative, meaning there is no persistent late deceleration. And when there is no persistent late deceleration, the baby is safe for the next 7 days. Okay. And when the result is suspicious, what is the responsibility of the nurse here is just to repeat the test. We also have what we call as internal fetal monitoring. Actually, in the NCLEX and in the Philippine nursing license for exam, this comes out with a question asking you that when the mother is suffering from HIV, the mother could not have internal fetal monitoring because they will be putting the electrode in the fetal scalp for us to monitor FHT, and that would now be posing risk to the baby for acquiring the HIV. So this is the external fetal monitoring. This is how they do the NST. So we have 3 transducers. In the internal fetal monitoring, we call it as your electrodes, but for this one, we call it as your transducers. Okay, we have here the contraction transducer. Kung nakikita nyo, it is in the fundal part of the uterus wherein the uterus is actively contracting. And we have here another transducer. This is the FHT transducer. Okay, the FHT transducer, it gets or it records the fetal heart tone of the baby. Okay, and then you have here another pencil-like, okay, na pinapahawak sa nanay. They will let the mother hold it, and that is what we call as the fetal activity transducer. So what are again the 3 transducers in external fetal monitoring? You have your contraction transducer to measure contractions. It is placed on the fundal part of the mother because the fundus is the one that is actively contracting. And you have your FHT transducer. So your FHT transducer is for the measurement of the fetal heart tone. And for the fetal activity, it counts the movement of the baby. And again, in the board exam, the baby should be moving at least 10 to 12 times in an hour for you to say that the baby is doing well inside the womb of the mother. So this is how they will do it. Okay, so again, you will have the monitor there. So the monitor will just give you an exact record of how the baby is doing. So this is an internal fetal monitoring. As you see, the transducer is embedded on the scalp of the baby. And again, you could not do it in a patient with HIV because it will just pose a risk to the fetus in developing or acquiring the HIV or the virus of the mother. So for the health teachings, the schedule of clinic visit according to the book from diagnosis of pregnancy up to 32 weeks, it should be every month. From 32 weeks to 36 weeks, every 2 weeks, and then 36 weeks until delivery, it should be every week. Take note, my dear nurses, that this will now vary. Okay, this will now vary if, for example, the mother is at risk or in the presence of fetal-maternal complication. The schedule of clinic visit will be modified by the attending physician. The exercise, of course, you have to have pelvic racking, squatting, and tailor sitting, rib cage lifting, calf stretching, shoulder circling, abdominal muscle contractions, modified niches. So these are done for you to be able to have a normal spontaneous delivery or a normal vaginal or normal spontaneous vaginal delivery. And you have here advantages of exercise during pregnancy. If you have a normal pregnancy, it will strengthen your muscles, and this will now prevent the possibility of lacerations, promote circulation, of course. And then you have here relieves tension and anxiety. It will now help you relax and improves posture and appetite. Posture for us to at least help correct the lordotic position later on. And then you have here improves metabolic efficiency for you to be able para mag-poop ka because you understand that you will have constipation during pregnancy because of the presence of progesterone, and progesterone is a relaxant hormone. So you have to do exercise to at least help your body eliminate this poops, okay? For dental care, of course, even if you're pregnant, you have to be healthy. Okay, dapat wala kang dental caries, and you have to have alkaline mouthwash because of the presence of heartburn or pyrosis, okay? You could not use acidic mouthwash because it might aggravate the presence of heartburn or pyrosis. Of course, you have to have lightweight clothing or non-constrictive because you have hyperhidrosis, diba? You have excessive um, sweating, and that is what you call as your hyperhidrosis. Excessive sweating uh, when you are ill, or when you are sick is what you call as diaphoresis. But when you say excessive or excessive perspiration during pregnancy, it is what we call as hyperhidrosis. And that is the reason why you have to have lightweight and non-constrictive clothing, because you will feel very, very hot during pregnancy. It should be absorbent and reasonably priced. Why it is reasonably priced? Why it is involved here? Bakit sinabi ng libro to be reasonably priced? Because you could not use this outfits after pregnancy, probably hindi na. Flat heel shoes because of the presence of the hormone relaxin. Hormone relaxin will help the woman to walk in a wide gait. That is why you are not allowed to wear high heel shoes, so that you will not be prone to fall. Fall. Huwag ka nang mahulog, okay? Okay, for paliligo, you have to have daily bath, but of course no bathtub because of the possibility of um, uh, falling or slipping, okay, or slip over. Okay, so we have here swimming is okay, but not to diving. The baby might just come out in your mouth, okay, or joke that. You have here, you should not be bathing if the vaginal bleeding, or if there's vaginal bleeding, or if the bowel is ruptured, for us to avoid infections. Breast care, of course, your bra will be larger because of the milk formation for you to for you to feel comfortable. And you have to, even in the board exam, you have to wash your breast with water only for you to prevent sore nipples. Immunizations, of course, you have to avoid live viruses like your rubella, mumps, or your OPV vaccine, or your oral poliomyelitis vaccine, because these are live viruses. Again, this could give the baby congenital abnormalities. And you have here hepatitis B and typhoid fever vaccine could be given only if risk factors are present. Next is we have TT immunization. Again, so your CHN will teach you for the TT1 to TT5. For TT1, okay, TT1, it should be given ASAP, and it will give you no protection. For TT2, it will be given 1 month after TT1, it will give you 3 years protection. For TT3, it will be given 6 months, okay, after TT2, and it will give you 5 years protection. For TT4, it will be given 1 year after TT3, and it will give you 10 years protection. And for TT5, it will be given 1 year after TT4, and it will give you lifetime protection. For employment, of course, huwag ka na maging kargador. No lifting of heavy objects because you are already carrying a gravid uterus, and no sitting and standing for a long time because this could give you complications. And then no excessive physical and emotional strain because all your feelings are congruent to the feelings of the baby. It could predispose you to develop complications in pregnancy, of course. And no to use of no to exposure of toxic substances like drugs. And for your travel, you have to avoid long trips in the third trimester, okay? Because you will now be preparing for the birth of the baby. And best time to travel, second trimester. And when traveling, in every 2 hours, you have to stop for 15 to 20 minutes. So you have to have your own car because the bus driver will get mad at you when you tell them to stop for every 2 hours, and you will just be looking down there for 15 to 20 minutes, okay? And your trip is from La Union to Isabela, okay? So how many? 10 hours, and that would be every 2 hours, 5 times kang bumaba ng bus. And you have to have your use shoulder lap and lap belts for your protection, and of course the place should be pressurized. For sexual relations, first try you don't want sex because you have fears of losing the baby. And because the semen contains prostaglandin, and prostaglandin could contract the uterus, and that could possibly cause abortion. Okay? And second trimester, you have an increased sexual desire. You've been waiting for a long time. And for the third trimester, you have decreased sexual desire because you don't want to hurt the baby inside. For contraindications of sexual intercourse, when you will be not when will you uh, when is the time that you are not allowed to have sexual intercourse? Of course, if there is a deeply presenting part, okay, you might be hitting the baby, rupture of bag of water, you might be causing infections. vaginal bleeding or spotting, you might aggravate the bleeding. Okay? And then you have an incompetent cervix. When you say an incompetent cervix, it is a cervix that cannot hold pregnancy until term. Incompetent cervix, it is a cervix that cannot hold pregnancy until term. Actually, there are other terms for incompetent cervix. It is called your premature cervical dilatation. It is called as your preterm cervical dilatation and your cervical insufficiency. What is again? Incompetent cervix or cervical insufficiency, preterm cervical dilatation, or premature cervical dilatation. And for alcohol, again, up to this moment, up to the pinakalatest na libro, no to alcohol during pregnancy. Abstinence is absolutely necessary. Okay? Next is, I'm sorry for the delay. We are almost done. Caffeine, of course, wag kang puro kape, not more than 4 cups a day, okay? Because you might have problems with sleeping or feeling satisfied na wala ka namang nutrition and it might increase or diuresis, okay? And you will have mood swings and sleep disturbances. And it may interfere with iron absorption. This is actually a new finding that coffee or caffeine could interfere with iron absorption. And you know for a fact that you need iron because you have physiological anemia of pregnancy. And of course, if it's 3 in 1, the baby will have diabetes later in life. Again, guys, in pregnancy, there are drugs that should not be taken or if it's not prescribed by the physician because there are drugs that could cause you teratogenic effects. Like, for example, you have your androgen, estrogen, and progesterone. This could cause masculinization of female infants. So magtataka ka why there are females nagtatawang lalaki. Thalidomide, so you will have a baby of phocomelia, cardiac and lung defect. Sorry for the wrong spelling of the defect. Anticonvulsant or dilantin, those who have maintenance will have babies that will suffer from cleft lip and palate or congenital heart diseases. For lithium, any drug that contains lithium could cause congenital heart defects and tetracycline, yellow staining of the teeth, or inhibit bone growth. For vitamin K, the baby might have hyperbilirubinemia, and salicylates or aspirin, the baby might have neonatal bleeding and decreased intrauterine growth. Next is you have your sodium bicarbonate, fetal metabolic alkalosis, streptomycin, nerve deafness, vitamin A, central nervous system defects, iodides, goiter, mental retardation, and ayan, sobrang sa iodized salt. Steroids or cortisone, cleft lip and palate, and barbiturates could cause bleeding disorders. So you should be very careful. So what are the dangerous signs of pregnancy? Any bleeding of any amount is a dangerous sign. It might be an abortion or preterm labor. Persistent vomiting. Persistent vomiting is what we call as hyperemesis gravidarum. Okay? It's what we call as hyperemesis gravidarum. Excessive vomiting during pregnancy. Okay? Hyperemesis gravidarum. Because vomiting in pregnancy must be morning sickness. It's only good for 3 months. And if it's beyond 3 months, that is hyperemesis gravidarum or persistent vomiting. Next is we have chills and fever. Okay, chills and fever might be suggestive of infection. Sudden escape of fluid from the vagina could be suggestive of preterm labor. Swelling of the face and fingers could be signs of preeclampsia or hypertensive disorders in pregnancy. And visual disturbances. Okay, visual disturbances. When we say visual disturbances, you might be seeing or you might be having like curtains before your eyes, and that could be a sign of high blood pressure. And painful urination or dysuria. Painful urination or dysuria is could be the reason or a sign for UTI, and that could predispose the woman to have what? Preterm labor. Abdominal pain, particularly epigastric pain, is a sign of high blood pressure. Severe or continuous headache that is not relieved by analgesic is a sign of high blood pressure. Another is we have minor discomforts of pregnancy. Number one is nausea and vomiting. Okay, nausea and vomiting. When we say nausea and vomiting, it's morning sickness, and the nausea it's because of the glucose depletion of the mother, because the glucose of the mother is being used by the baby for his brain development, since brain is one of the organs that will first develop in a baby. And vomiting might be due to human chorionic gonadotropin, psychological stress, and thyroid dysfunction. Frequent urination is a minor discomfort because of the increasing size of the gravid uterus pressing against the bladder. And fatigue, of course, because you're carrying a child. Okay, another baggage. Okay, number four, breast tenderness and nipple irritation due to milk formation. Leukorrhea, parang white mensa in your panty. Leukorrhea is what you call as your, actually this is a board question. Leukorrhea is your operculum or your mucus plug. This is actually white in color. So white siya, near the cervix, white, near the cervix, okay, white near the cervix, and it protects the baby against infection, okay, against infection all throughout pregnancy. So that is what we call as your leukorrhea. Nasal stuffiness, you might have a repeated parang allergic rhinitis due to estrogen, heartburn or pyrosis, so you have to avoid acidic mouthwash, and varicose veins because of the pressure of the gravid uterus, and backache is common. That is uh, the end of or the effect of lordotic position in pregnancy, and leg cramps because of the pressure of the gravid uterus, and headache. Okay, so these are minor discomforts in pregnancy. That is all about pregnancy, and we will have other topics like labor next time. Thank you and good evening. Take care of yourself. And the highest form of self love is for you to prepare for your battle and for you to be able to top the board exam. And there is no shortcut